Fire and Rescue.
Now, you know, ironically, it was just this afternoon that staff at USA Medical Center showed us what they are doing to prepare should a case of Ebola be diagnosed in Mobile.
Local 15's Madupe Dowu continues our team coverage tonight. Madupe, you spoke with hospital officials today about this very scenario.
That's right, Kim. You know, and actually our sources within USA Medical Center say the hospital could have received this patient a little bit earlier had they prepared for her arrival. I was at the hospital earlier this afternoon where hospital officials stressed they were more than equipped to handle Ebola patients. They say they have questionnaires for all patients asking if they've traveled to parts of West Africa before they treat any patient. They also have isolation rooms with negative pressure, which keeps the air away from infiltrating the rest of the hospital. And they say they have the proper protective gear. Officials have implemented a buddy system while making sure that the gear is put on and taken off correctly so that there is no transmission of this deadly disease. But it's important to take a look at the timeline here. Officials say the woman arrived at the Mobile County Health Department earlier this afternoon. The health department contacted USA Medical Center, we're told, at around 4. And this woman did not arrive to USA Medical Center until 7 p.m. or close to 7. Health department officials say there was a language barrier and they had to find transportation for the patient. But once again, our sources say otherwise, stating that the hospital had to prepare for her arrival. Now, the health department officials believe there was a small possibility, and we've actually learned that she is at no risk for Ebola. As for the USA Medical Center, it's not the first time that they've dealt with suspected Ebola patients.
Much more likely to see some diseases that would be from the Caribbean that can be hemorrhagic fevers as well, rather than Ebola. So we want to add that question of, have you traveled or have you been in contact with anyone who's traveled in the last 30 days? Of course, we've had some scares, but they were overreactions.
And that's exactly what this was, another scare. USA Medical officials obviously happy to report that there is no risk for Ebola. Meanwhile, training will continue. All USA workers, not just their healthcare providers, must attend a mandatory safety fair this week to learn the latest guidelines, the CDC guidelines on treating Ebola and preventing its transmission.
Madupe, thank you. Once again, we're going to tell you that USA medical officials have said the woman who was brought in tonight has no risk of Ebola.
Good test run for a lot of folks who are in this in the healthcare field, because for all intents and purposes, we certainly saw a lot of things go into action today, and for the most part, it looked like successful, and I was very happy about the way this turned out.
Job well done.